How many of you are trying to get pregnant? And how many of you are putting so much burden on yourself? How many women are going, oh, it's my fault that I can't get pregnant? Did you know that there's a huge factor, and it's how healthy is the male? Today, I'm talking about what are the factors that are causing male infertility. It's not always the woman, so we need to think about, as men, what do we need to do if we're planning to have a child? We have just as much of a role. But I'm going to talk to you in depth about one of the most important pieces, something that's not really being talked about. I'm bringing to light in this knowledge bomb for fertility. You know, so many of us are putting the burden of infertility on the female, right? And we see this often. We see it in movies. You know, I was just watching the new American Horror Story, and so much of this woman, she went through in vitro fertilization because they couldn't get pregnant. But it was very much so on her, the lead actress. And I was thinking to myself, we need to talk a little bit more about fertility. But did you know that in almost half of the infertile couples, the male factor is the sole or secondary cause of infertility? Now, fellas, it goes without saying, if you're planning to have a kid, you have to get yourself healthy. In about a year or 2 years minimum of really getting your health together before you have a kid, it's going to be really important. Because think about it. The sperm is adapting to the environment. So the sperm is adapting to the environment that you are in. These are epigenetic changes. And it's really important for us to bring to light that, okay, no, I'm responsible for giving the signal to my sperm that the world is safe, that there's an abundance of food, that it's not a stressful world. That's your responsibility as a man before you have a child. So in this episode, I'm going to cover all of the really important things that are affecting that epigenetic signal to your sperm. Multiple studies out there show that excessive alcohol consumption causes an imbalance in your sperm quality, concentration. So absolutely, if you're drinking alcohol, I would consider full cessation of alcohol or reducing it significantly, especially if you plan on having a kid. We know the same about tobacco. Of course, it goes without saying. That one's an obvious one. The same goes for marijuana smoking. You may want to reduce the amount of weed you're smoking because the number and quality of sperm can go down as well. Other factors, cocaine use, of course, medications, testosterone replacement therapy, long-term anabolic steroids. If you're on cancer medication, like chemotherapy, some of them can affect your sperm. Certain antifungals and antibiotics you may have not known can affect your sperm. So if you're especially on this chronically and trying to have kids, it might be one of the sole reasons why you can't have kids. Some ulcer medications can also impair your sperm production and decrease overall male fertility. Really, something like hormone imbalances are what we need to start looking at. If you have any issues in your brain, your hypothalamus, pituitary, it's going to affect the communication between your brain and your testicles to produce hormones that create sperm. So yeah, naturally, we have to make sure that we're optimizing our brain health. Alterations in these hormones can be affected by many things, including just stress. We want to think about exposure to radiation and x-rays. Yes, your phone actually plays a role. If you plan on having kids, put your phone on airplane mode. Yes, there's data out there that shows that the ambient radiation from your cell phone in your pocket near your testes, fellas, is going to affect the quality and the number of your sperm. So make sure you're swiping on your phone, putting it on airplane mode if you put it in your pocket. Other than that, make sure you keep your phone away from you, away from your body, especially your testes. Very important if you're planning to have children. Other factors, heavy metal exposures. We want to make sure we're testing for heavy metals, making sure that we don't have a overaccumulation of them throughout life. A lot of us do. When it comes to heavy metals, there's different types of heavy metal tests you can do out there. Blood isn't going to show you that much. Just urine one without any provocation, medication, something to pull the heavy metals out, is going to be pretty much useless. I don't like the hair test. They don't really show that much either. So really what you want to do is take a provoked urine test where you take a medication that sort of pushes these heavy metals out of the body, chelates, and shows you in that moment how much you're holding in your tissues. Because heavy metals are in the tissue. They're not just floating around the blood. You'd be dead if all of them were. We know that industrial chemicals like pesticides, yes, they can affect your sperm, organic solvents, toluene, xylene, her herbicides. Yes. Emotional stress, I mentioned stress before, a big factor that puts a stress on your nervous system, which ultimately is going to put a stress on your immune system, which is ultimately making you more susceptible to different infections and making you more susceptible to the damage caused by industrial chemicals, heavy metals, radiation, all the other stuff. It's actually a cascaded effect throughout. And making sure you're at a good weight. Before you have children, you want to make sure you're actually in a healthy hormonal balance of weight. You're reducing that influence of estrogen coming from the adipose cells in the fat and increasing your muscle, making sure you have that anti-inflammatory effect in the body. We know that certain infections can affect your sperm quality. Ones that affect or cause inflammation in the epididymis of the reproductive system or the testes, very important, and different STDs. Now, I brushed over so many of these important factors that are causing infertility issues in couples. And you may have heard about a lot of these. But in my opinion and the scientific opinion, really what we're seeing now is this is being one of the main causes of infertility. And we're not speaking enough about it, and we have to, and it's time.
La piel es el órgano más grande. Absorbe todo lo que pones en su interior, así que, ¿por qué te conformarías con productos químicos agresivos e ingredientes tóxicos? De hecho, Alitura está redefiniendo el cuidado de la piel. Tienen algunas fórmulas puras y naturales ricas en nutrientes que realmente nutren y curan la piel de adentro hacia afuera. Tienen una mascarilla de arcilla característica que está repleta de minerales que desintoxican y rejuvenecen la piel. Tienen un humectante cargado de ingredientes botánicos y potencias antienvejecimiento. Cada producto tiene ingredientes reales de alto rendimiento que a tu piel le encantarán. Confío en Alitura porque priorizan lo que realmente funciona, sin rellenos, sin concesiones. Son abiertos sobre lo que contienen sus productos y son todas las cosas más limpias que provienen de la naturaleza para una piel más saludable. Visite alitura.com y use el código DRG. Vas a obtener un 20% de descuento. Adopte el estilo de vida de Alitura y vea la diferencia que la naturaleza puede hacer en su piel. ¿Sabías que la calidad del aire en tu hogar puede ser 100 veces más tóxica que la calidad del aire exterior? Y la razón de esto es que no tenemos en cuenta la emisión de gases, los productos químicos que salen de los materiales de nuestro hogar. Cuando combinas eso con productos de limpieza tóxicos en casa, creas un espacio que realmente puede crear una carga para tus pulmones y todo tu sistema. Como médico y experto en medicina ambiental, hablo sobre la importancia de tener aire limpio en el hogar. En mi opinión, todos los hogares necesitan un purificador de aire, pero no cualquier purificador de aire. Necesitas uno bueno. El purificador de aire Jasper es, de lejos, mi favorito. Tiene potencia de grado comercial con un diseño moderno y minimalista. Cuenta con tecnología Whisper Silent, por lo que se adapta automáticamente a la calidad del aire de tu espacio sin hacer demasiado ruido. El purificador de aire Jasper es potente y eficaz contra una amplia gama de contaminantes. Estos contaminantes pueden ser moho, alérgenos, humo de incendios forestales e incluso contaminantes comunes del aire interior. Tengo uno en cada piso de mi casa que está limpiando activamente mi espacio, por lo que mis pulmones y mi sistema inmunológico se están tomando un descanso y puedo ser más saludable. Jaspers filtra más de 5 veces más grande que la mayoría de los otros purificadores de aire, por lo que capturarán más partículas con cada uso. Al filtrar el aire de su hogar, es una de las formas más sencillas de mejorar su salud en general. Si tienes mascotas, el Jasper filtrará la caspa de las mascotas, y con Jasper en su habitación durante solo una hora, las partículas en el aire se reducen en un 95%, lo que permite un aire más limpio para que su cuerpo descanse y se recupere y obtenga un sueño profundo. Jasper tiene un prefiltro, un filtro de carbón activado y un filtro EPA, todo muy importante para estar limpiando tu hogar. Y una de mis características favoritas de Jasper es que si su Jasper tiene alguna falla mecánica, le enviarán una nueva sin hacer ninguna pregunta. Para conseguir un Jasper, vaya a las notas del programa y haga clic en el enlace, o vaya a jasper.co.drg. Eso es JASPR.co.drg y use el código DRG para obtener un 20% de descuento por tiempo limitado. Entonces, si desea el mejor purificador de aire de la industria para mantenerlo a usted, a sus hijos y a su mascota seguros, consígase un Jasper, no se arrepentirá. Hola, familia de Alda y Self, si estás listo para llevar tu viaje de bienestar al siguiente nivel, quiero que te unas a nuestro boletín y obtengas un acceso exclusivo de primera mano a todo lo que tenemos para ofrecer aquí en Alda y Self. Serás el primero en recibir descuentos especiales en mis productos favoritos de la semana, acceso anticipado a descuentos de nuestros eventos e incluso ofertas exclusivas de los invitados que aparecen en el podcast. Además, obtendrás historias personales profundas que respaldan tu sanación mental, física y emocional, historias que no comparto en ningún otro lugar que no sea contigo. Piensa en ello como tu pase interior al espacio de cúrate a ti mismo. Y aquí es donde te mantendrás inspirado y conectado en tu viaje hacia el verdadero bienestar. No te lo pierdas. Regístrese ahora y comience a obtener lo mejor de todo primero.
When you look at the effect of endocrine disrupting chemicals, things that are affecting your hormones, and how they affect your testosterone and how they affect sperm quality, at this point it goes without question. EDCs, or endocrine disrupting chemicals, are really driving male infertility and fertility issues across the board in females too. So if you're trying to have a kid and you can't, look no further than EDCs. These endocrine disrupting chemicals or hormone disrupting chemicals have an impact on human reproduction and development. Exposure to these endocrine disrupting chemicals in humans can occur via absorption through the skin, inhalation in the air, or ingestion of contaminated food or water. However, human exposure to EDCs occurs most frequently when contaminated food is consumed. So what are they? You may have heard about them. Bisphosphonates A, phthalates, and parabens are really the big three that are causing so much worry as to what is causing male infertility and female. But we also look at things like heavy metals and different pesticides that have these chemicals in it. Now, for males, EDCs cause impaired reproductive function, male infertility, altered fetal development, cancers of the testicle, prostate, and yes, breast cancer for men and women. And what happens is your hormones are affected. EDCs can interfere with normal functions of endogenous hormones by changing hormone levels, by blocking or boosting hormone production, or modifying hormone transport across the body, thereby overall disrupting your hormonal control. So one of the best papers out there is a 2021 meta-analysis out of Switzerland that really reviewed all the data on these chemicals and found some interesting associations with semen quality. And it was a super telling review. So fellas, if you're planning on having a kid and having trouble, you need to get your urinary BPA, phthalates, and parabens tested. That's number one before having a kid. Higher levels of urinary BPA and phthalates showed a correlation of impaired semen quality and increased DNA damage in the semen. Bisphosphonates are a significant class of those endocrine disrupting chemicals. And the most well-known and possibly most extensively researched of all is BPA. And it's widely used in almost all the plastics that we use, inner lining of cans, receipts, dental sealants, and it has multiple forms and analogs like BPF, BPS, BPAF. The most studied one, BPA, shows that it causes abnormal cell proliferation, and these chemicals have a direct effect on your sperm, changing its motility, its viability, all because it's causing oxidative stress to the DNA. Now, here's how the other two chemicals affect your sperm. Considering phthalates and their metabolites, all studies have found a positive association between urinary levels of phthalates and at least one semen parameter indicative of low semen quality. Some studies also reveal sperm DNA damage all the way to male infertility overall. Phthalates in themselves are a class very similar to BPA. They basically are used as plasticizers for PVC, making them flexible, durable, and just long-lasting. Numerous individuals who are exposed to these chemicals due to the widespread plastic uses that we are of our daily life, basically, in addition to thousands of employees who are working with it, has been shown to have the disruptive and harmful effect of these chemicals in their urine. In general, urban men were found to have much higher levels of phthalates than rural men. Additionally, phthalates were found in semen and statistically higher amounts in infertile men than fertile males. In one concerning study, we saw that males who had high levels of phthalates had 4.3 milliliters smaller testicular volume and 0.87 milliliters lower semen volumes than men who were less exposed, which is a really big problem because it's not only emasculating us in many ways, but it's also reducing our fertility. Big issue, especially when you're trying to have a baby. All of these changes are effectively deteriorating male reproductive function. And lastly, parabens. A lot of people ask me about these. They're not necessarily coming from plastic products. You're finding these things in like toothpaste, shampoos. Can this chemical hiding in some toothpaste and some shampoos be causing male infertility? Well, the answer is yes. It's called parabens. And it's found in cosmetic and medicinal products. And not just toothpaste and shampoos, also shower gels, moisturizers, lubricants, makeup, topical and oral pharmaceuticals, and even food preservatives. So it makes it really challenging to avoid them. But multiple in vitro and in vivo and human studies have found that parabens have a weak estrogenic and anti-androgenic actions, meaning that it's going to increase the estrogen in the body and reduce testosterone in the body, which can be detrimental for sperm health. It was found that a percentage of sperm with abnormal morphology, or just physical features, and high DNA damage was significantly increased with urinary paraben concentrations, while also seeing that the motility or the movement of the sperm was decreased while the testosterone levels decrease as well. Now, how are parabens affecting our sperm? The same way BPA and phthalates are, by these reactive oxygen species that are essentially generated and affecting and destroying amino acids, proteins, carbohydrates, lipids, but most importantly, DNA. While reactive oxygen species aren't necessarily a bad thing, when we're exposed to too much, it's causing increased amount of inflammation and are causing epigenetically induced mutations in the sperm DNA. Okay, so with all that said, what do we need to do? If you plan on getting pregnant, we have to at least a year really start working on our health, right? Men, women, the couple really needs to work on the health. So you hook up with a functional doctor or you hook up with a naturopathic doctor. Go to naturopathic.org. You can find one in your area. Functional doctor, you can go to ifm.org, find one in your area. You have to connect to a doctor who can integratively and holistically treat you. What that means is most likely they're going to do nutrient testing to make sure that your body is nutrient dense, not nutrient deficient, and you can handle having a baby and your sperm is healthy. They're probably going to give you a urinary test to check out your oxidative stress load. How your sperm looks. You can get your sperm tested. You can see how viable, the motility, the concentration, the morphology. You want to make sure your sperm is strong. You are probably going to get a urinary test that is going to show what chemicals or endocrine disrupting chemicals are in your system. Very important. And you're going to start getting a big picture about the things that you need to change. You're probably going to get a full intake with your weight to fat ratio, make sure that you're actually at a good space. They'll ask you lifestyle stuff to optimize everything. Again, this show isn't just for men, it's for everyone. If you're planning to have a baby, you want to make sure you're doing the right steps early on. You're optimizing the body because you want to give the body the signal that the world is safe, right? The epigenetic signal that the world is safe, which you're communicating to your sperm and your eggs right now. Is the world safe, yes or no? And that's changing. So really, really connecting to what's my level of stress? How can I reduce that level of stress? Am I repressing emotions? This is why it's such a big role for everything, right? Because it's causing so much downstream stress while getting the nutrient tested, while getting your gut tested, while getting rid of the cigarette smoking, getting rid of the alcohol, getting off the medications that you don't need to be taking, really making that change in your life. Because day to day, week to week, you have a new signal about the world into your system. You want to make sure when there's conception that the signals to the world is that the world is safe, especially coming from the men early on. For mom, we got to make sure that mom is healthy through the whole pregnancy, the world is safe through the pregnancy, that there's an abundance of food, that the stress and the arguments are down, that we're actually creating the physiological mirroring that the outside world is being experienced by the inner world early on. Because what's happening is in vitro, the baby is responding to those messages that are being sent through the blood, from the nervous system to the blood, into the placenta, and getting information always, 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 is the world safe? So fellas, it is our responsibility to optimize our sperm to the healthiest sperm possible ever. Conception happens, and then it's our responsibility to show up for the women and create the space and hold the space for them to feel taken care of, safe, and held through this pregnancy, to give that signal to the baby, yes, I'm coming into a world where it's safe, where it's beautiful, where it's abundant, and where there's love. For me, those are the keys to having a baby. But really, to getting pregnant, we want to make sure that we're optimizing both men and women. It's not just women. So follow these rules, fellas, and you're going to find your sperm is going to be better than ever.